In this case, the patient is wearing a large temporary bridge. And you can change the density of these images. So I'm going to eliminate the bridge. So this is the case. We have a temporary bridge going all the way from 2 to about 13. And there was room for 4 implants. In fact, we placed 3. But to do this case without a wax-up was quite simple. I took an impression, an alginate impression of the patient without their bridge, and I took an alginate impression of the patient wearing their bridge. And these data were merged into the planning software. The other question was, how do you merge the data in? The software has the facility to allow merges of different data sets on the basis of fiducial markers or on the basis of anatomy. So that's built into the Blue Sky Plan 3 software. So when I planned this case, I made the bridge slightly translucent. And basically, I just brought the implant into position. I rotated it. I put an abutment on it and rotated it and lined it up with the center of each tooth. And once I had this one in, I duplicated it, and I lined it up with the center of the next tooth. And the same thing going on down the line so that each implant is in the center of the tooth. I had no idea how this would shake out with the bone, but I placed it first. I shot for ideal position. So that was in the mesial distal dimension. And then buccal lingual, I'm able to see exactly where these are. The center line of the implants are in the center of each bicuspid, incisal edge, incisal edge. So that was the first phase of planning. I'm able to project the outlines of the temporary bridge onto the cross sections. So this is the tooth number 4. This is the second bicuspid. And here we have an outline of the temporary bridge. So now I was able to take the implant. Here's the bone. There was a sinus graft done. And I'm able to line it up in the bone and in the central fossa of that implant. I'm sorry, of that crown, of that temporary crown. And we go to the next, number 5, same thing. A little buckle to the central fossa, but still quite ideal. Go to number 6. We were fortunate the bone was getting thinner here, but still allowed me to line it up with the incisal edge. And finally, number 7, same thing. So in terms of ease, I mean, from where I'm sitting, this is a lot easier than having to set up a large wax-up. And it's extremely accurate, and it's a very streamlined way of getting implants in the correct position in a totally restorative-driven environment. There are tools here whereby you can parallel one implant with another and things like that. And finally, I can superimpose the temporary bridge on top of the patient's anatomy, bony anatomy, and get a look at the relationship between this implant and the adjacent tooth, and this implant and this adjacent tooth, as final confirmation that these implants are in safe positions. This is a surgery. This is that patient, the one we just planned. This is their surgery. And this was done with a tube guide. Here you can see the ridge that we're using. Here's the tube guide in place. When I raise flaps, I often like to make bleeding points with a with an endophile. I'm trying to retain attached gingiva, so the bleeding points serve as guidelines for my incision. So I'll make my incisions right through the bleeding points because I know those are the center lines of my implants. So I make my incision. Here you can see our tube guide in place, and you can very easily raise a flap with our tube guide. We do not have a flange covering the site. So we can do tubeless, we can do tubeless, we can do flapless surgery, or you can elevate a flap. Here's the ridge, and again with the tubes, I just went through with my twist drills, creating osteotomies. Here are the osteotomies, number 4, 6, and 7. Again, I'm using a tube guide to center my driver to place an implant. And here's the final case. Here's the closure, and again, my reason for raising a flap here was I wanted to retain a thick band of attached gingiva on all these teeth. And here's with the bridge in place. You can see the relationships and the radiographs of the implants. So that's an illustration of a case that was done using a temporary bridge as for future tooth position.